I find that the men tend to be able to negotiate more than the women. So I've noticed that my male colleagues, when they negotiate, they'll get the higher rate. But if, I do the same thing with the same company, it won't happen.
One thing I've noticed in the time that I've done disability reviews and even some IME work is that we're not that great at documentation. I'm sure you've noticed that as well, because as you go back and you're reviewing all these records, there's so much copy pasting, right? And there's a lot of copy forwards, and there are not a lot of objective findings documented in clinical exams, which ends up kind of biting the patient in the butt when they're trying to apply for disability. So I think one thing doing this work has taught me is to be more cognizant of how I'm documenting things. Another thing it's taught me is that there is money to be made outside of clinical medicine. I've noticed that when you're working for literally anyone in the healthcare system, you are somehow getting paid more than actually seeing patients in clinic, which I think you might have also experienced. So, with all that in mind, do you feel like you have more control over your career or have more career longevity now that you kind of shifted into non-clinical work as compared to if you were like a full-time clinical practitioner?
Definitely, and you bring up a lot of good points there. Because doing my work in the non clinical arena has strengthened me as a practicing physician. Not only with my documentations, but even how I treat my patients. Because when I look at these cases, I often see what not to do, and I see other ideas of how to handle certain cases that are actually good ideas that I never even thought of, and I'll see where, a neurologist, treats a certain condition in a different way that I was taught. And a lot of times that would provoke me to do research on it. And I'll be like, oh, that's actually a really good idea. And I will start implementing that in my practice and have a lot more success with my patients. And then, I think, financially too, that's an important piece too, because I mean, it's always kind of this hush hush thing, when you're in medicine. Oh, you shouldn't talk about money. You shouldn't, try to advocate, for increased pay. But, frankly, this is our job and this is how we make a living. And so, we need to have a certain amount of income. And also, we have a lot of debt from student loans, all the training we did to get to this place. And it definitely makes me feel like I have a little bit more of a cushion because the non-clinical realm does, tend to pay well. So it's nice to be able to kind of mix the two, the clinical work and the non-clinical work, and feel more financially stable, and then also feel like I'm growing as a physician in the process.
This is from my own education, since you're doing expert witness. So, how do you handle situations where you kind of get dragged into bad documentation or um, situations where colleagues are not meeting the standard of the practice, and then you end up inheriting patients like that? How do you protect yourself?
Yeah, so this is definitely a fine line that I think all of us have had to walk. And ultimately, you can't control how someone else documents. You can only control how you document. So, I try to document factually, but obviously not calling anybody out, but just, you know, factually, I picked up this case today, you know, this is what I noticed, and, here are my concerns, and here are my plans. I can only do you know what I can only control what happens from the minute I get involved. I can't control, what happens in the past. And I mean, unfortunately, the medical legal system doesn't always discriminate against that immediately, because when a lawsuit comes to light, these attorneys, they throw everything at the wall to see what sticks, including every person who's been involved in the case. But if your documentation has been really good from your point onward, you know, once you're in deposition, things are going to get weeded out, and a lot of times, these cases, will be dropped against certain physicians, usually the ones who have documented really well, and who didn't breach, any standard of care, and they'll keep the lawsuits against, the people who don't have, the documentation that supports what they did.
I think that's a good point, Shala, that you brought up, and great response, Michelle. Because the thing is, I think that's all of our worst nightmares, right? Like to be deposed on a patient care issue. And sometimes when you are working with folks who might not be meeting those standards, you get dragged into it as well. So I think doing this kind of work, even though I think initially, if you're a physician and you're hearing about physicians doing this work, it almost feels icky, like you're working for the other guy. But in reality, I think you can use this to make yourself a better clinician, honestly, make yourself more defensive in the way you're documenting. Like me, I try to write out everything, why I'm doing certain things. And that way, there's no question about when and why. Because just being in some of these depositions myself, I know they like to nitpick little things. So you have to be very judicious in what you're putting down. Moving forward, Michelle, do you think more physicians are going to be doing non-clinical work? I mean, right now, I feel like I've already started seeing some of my friends who are still in academic medicine, like dabbling in disability review, um, maybe even trying to schedule some IME exams because they've seen kind of me do it. And I've told them, like, this is possible. But do you kind of see that more physicians are going to move in that direction?
I do. I've also seen a lot more physicians show interest in this. I would say, over the last couple years, I've had a handful of people a year come to me and ask me about my non-clinical work. I think with the way the healthcare system is moving. Again, like I said before, it's moving more to production based rather than quality based care. And so there are a lot of physicians that aren't happy with that because that's not how we were trained. And because of that, it's leading to longer hours, less pay. And so burnout is on the rise. And ultimately, people want, for the most part, a better work life balance. And especially in medicine, when you spend all those years training, you don't want to be married to your work for the rest of your life. And so I think because of those reasons, a lot of people are going to, actually are migrating more to the non-clinical side of things. And I think we're going to see a market increase in that in the future.
Do you have any specific advice for people who are looking to do this work, like something that you wish you'd known before you started?
So, my best advice would be to ask around. If you're interested in this, reach out to colleagues that are doing this and get their opinion on it. And not just one person. Reach out to as many as that are doing this to see kind of what their view on it is. What the advantages and disadvantages are. Some of the work, can be stressful, especially when you're dealing with the medical legal realm and expert witness cases. When you're in deposition or you have to go to court for trial. Those are stressful situations. In this realm, and making sure that you're okay with that. Is something that obviously should be done before you get involved in the work.
So for those physicians who are feeling stuck in their clinical work environment, what is the first step that they should be taking into exploring non-clinical work?
So there's a lot of information, out on the internet, about non-clinical work. What I did, first I talked to some colleagues that I knew were doing this, and I I already kind of had familiarity with it because of in residency that attending physician who was involved in it, and he talked to me a lot about it, and I became very comfortable with the concept of non-clinical work. And I think talking to people that you're familiar with about it is a really good first step. And then if you're still interested in it, going on the internet, some of the people that I mentioned, the Seek website, the Chris Brigham, if you're interested in independent medical exams and learning about the AMA guides and how to use them, or just doing a general search on this stuff on the internet is a good jumping off point. And then if there's still more interest, then looking into the courses, looking into the conferences where it really lays out, and differentiates between these different options and what it all entails and what to expect. Those are kind of the steps that I took before I jumped in. And once I went through that process and I was like, you know what, I'm ready to try this. I think I want to do this. I at that point I formed my LLC and started getting things set up so I could start the non-clinical work.
And how many years did it take you to be comfortable in this work?
So, the disability file reviews, it took me about a year before I felt really comfortable with that. That was a lot quicker. I think for the expert witness work, it was more 2 to 3 years before I felt like okay, I can start doing the depositions and those type of stressful aspects of it without extra training.
And I think what you said is absolutely right. Like, we do need to feel a little bit more empowered and not feel stuck in our careers. One thing that I remember now still that I receive a lot of companies do reach out for disability reviews and other things, and I've noticed that not all the playing field is equal. Some of them will try to shortchange you. Some of them will offer like very little pay for lots of record review. Not all companies are like that. There's a company that I have been working with for almost a decade, and they're wonderful. They pay fairly. But some of the newer companies, especially the ones that are associated with insurance companies, will do that. Do you have any specific methods of how you like kind of sort through that out? Or do you just, once you hear from them, just say, well, these are my rates?
Yeah, so when it comes to, these disability review companies or, the companies that deal with utilization reviews, um, a lot of times, they just have set rates that they pay and there's no negotiation. And if it's too low, then I pass up because I have other companies that, you know, compensate more for the same amount of work. So I, give priority to those companies. Sometimes I have heard of people being able to negotiate rates. What's interesting, kind of going back to what we had talked about before, I find that the men tend to be able to negotiate more than the women. So I've noticed that my male colleagues, when they negotiate, they'll get the higher rate. But if I do the same thing with the same company, it won't happen. So that's kind of interesting. But then there's other companies, where I say, okay, this is my rate. They'll either pay it or not. It really depends on the situation, but I do have a minimum in my mind. So if a company, you know, wants to retain my services and they say, well, this is our rate, I can try to negotiate it. And if the negotiation doesn't go beyond, go above my minimum requirement, then I just won't sign on to that company.
And I think that's a really good point. People who are listening to this, it's important to know there are resources like Seek, and you could talk to other people to see how much the standard is, because ultimately, I think physicians might also be taken advantage of in some of these situations. I know if I didn't have the knowledge or have certain standards for myself, it's like, oh, this sounds totally fair, and then you're like, wait, how much are they making off of me? Truly. So this is all very helpful information to have. Um, do you do you see yourself continuing to do this? What do you think your future looks like? I know we talked about you have to maintain some clinical medicine, but moving forward, do you think you're going to just continue doing more and more non-clinical work and then eventually phase out, or what do you see for yourself?
Yeah, so I'm definitely going to continue what I'm doing now for the short term, but eventually I do see myself phasing out of clinical, maybe decreasing that more, and then increasing my non-clinical practice more. Depending on how that goes, ultimately I may decide to completely stop clinical medicine and then switch to a different non-clinical career that doesn't require the clinical medicine side of things, such as like medical liaison or working for like a pharmaceutical company or even consulting. Now, one thing I've also considered too, when I get closer to retirement, some disability file review companies, they will allow you to take cases as long as you were in active practice within the last 5 years. So that might be another option is if I just want to do complete disability file reviews, wait until I'm less than 5 years away from retirement and kind of phase out that way.
Santoshi and I have talked about this many times. It's just clinical medicine has become really, really frustrating. Unfortunately, the pay is stagnant, but the workload is more and more. And physicians are losing autonomy and the type of care that they want to give. And it's not about quality, as you said. And when it's not about quality, it puts us at risk, at medical legal risks. So I can see why what you see in your future is more of a non-clinical work versus clinical work. And same for us. We're always exploring options of non-clinical and how we can um, have an impact, not just clinically.
And more importantly, I think the remote nature of non-clinical work is also appealing, right? Because you can literally live anywhere and still earn a living. When you're doing clinical work, even if it's telemedicine, you have to physically be in the United States or you have to be licensed in certain areas. Whereas when you're doing non-clinical work, as long as you have one active state license, they don't care. They don't care if you're living abroad and doing this and then like flying in to do a week of locums. It gives your life a lot of flexibility. So I can see why it's appealing. Do you have any final thoughts, Michelle? Any last messages for anyone who's newly graduating or is considering non clinical work to augment their income and maybe even take it as a way out of clinical medicine?
Yeah, so I think we have to keep in mind that when we're in training, we are taught that as physicians, our only role is to be in clinical medicine to treat, diagnose, patients, and that we don't have any other roles. And it's almost during training, I felt like it was looked down upon to consider non-clinical positions. And my message is, if you're interested, even to the slightest degree of learning more about non-clinical positions, go for it. Just look into it. You know, don't let the institution of medicine dictate your life and how you want to work as a physician, whether it's in clinical medicine or non-clinical field. And don't be afraid. I think too, a lot of physicians are scared of going out of that comfort zone. I just recommend trying it. Worst case scenario, it's not for you and you can back off. But best case scenario, you find something different that's very rewarding and gives you a better work life balance.
The only final thought that I really had was Shala and I've talked about this in prior episodes before, but as physicians, we don't know how to market ourselves, or there's a lot of hesitancy to market ourselves. A lot of physicians don't even have a LinkedIn profile. Meanwhile, a lot of my consulting gigs that I've gotten, people reaching out for expert witness IME work has been through LinkedIn. Recruiters will contact you left and right on LinkedIn if you just have like the open to work thing up. But I don't know what it is about us where we're kind of trained to be very humble and not talk about our talents. like Shala and I were also talking about how if you look at a physician's CV, it's so limited in comparison to people from other industries. And I don't know why that is, because we are very talented. And it's not just that we know science and physiology, every aspect of our day to day, we have to know how to talk to people. We are leaders, right? We have to be organized. So it's a lot of different skill sets we have that we don't realize we have. And I think it's what you said, Michelle, like when you are in training, you're taught that this is the only thing you can do. And I think you end up selling yourself short, unfortunately. Yeah.
Very well put. I agree.
Thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share it with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.